Good morning, McKenzie County, and welcome to a special edition of the Living in McKenzie County podcast. I'm excited to have a guest with me today, and just to set the table a little bit, we are filming today. It is November 18th, and we will be dropping this podcast on December 2nd. And so what we are going to take the opportunity to do here for the next special edition short series here is talk to Lynn Welker-Fevold, who is the president of the benefit fund of McKenzie Health. And we're going to take some time today talking about Giving Tuesday. And so, Lynn, before we start talking about Giving Tuesday, can you share just a little bit about you and the work you do for McKenzie Health?
Sure. Thanks for having me today. I really appreciate it. I've been with the organization for almost 11 years, serving in the foundation capacity as president of our foundation, and then also serving as chief of marketing, innovation, and strategy for the healthcare system. I grew up on a ranch in Kilgore, Nebraska. We were about 80 people strong, and then literally 22 miles to school and in however much snow. That was really the case. So small town and ranching roots, and I have a deep appreciation for rural healthcare. My mom was an RN for almost 40 years and served in every neck of the healthcare system. And then also Critical Access Hospital gave my dad his first lease on life for his first heart attack. So it means a lot to me to be able to work in a fundraising capacity to help make improvements where needed across our facility. It's fun to work with donors, and it's fun to meet new people and really raise awareness to the great things that we have going on. And so thank you for having me today to talk about that.
Absolutely. So I would like to spend a little time hearing you explain Giving Tuesday to the listeners of our area, and explain what it is, what Giving Tuesday is, and really how they can participate in it.
So Giving Tuesday is a national day of giving. Everyone's familiar with Black Friday and Cyber Monday, but we also have Giving Tuesday. It's not the same day every year. It's either the end of November, early December. This year it lands on December 2nd. And the hope is that as everyone is making consumer choices and purchasing gifts and various things, that they'll also think about, hey, how can I give back, and how can I participate in something that's meaningful? Giving Tuesday is an annual initiative we participate in at McKenzie Health. And just to give you an example of something that was donor funded, that really helped bring a lot of smiles and joy and cheer to our assisted living residents, actually, is the renovation of the Horizon Kitchen, which was, again, all donor funded, and a Giving Tuesday activity that we're super proud of. The kitchen is a place of idea exchange and meeting with family and friends, and coffee and cookies and baking. And it needed just a perfect facelift that Steve Sanford of Sanford Construction put together. And many of our residents knew Steve from renovations, in their own homes prior to joining us at the assisted living. So it was really fun for the residents, but also super impactful for the organization, and a real quality of life initiative that we were able to move along because of Giving Tuesday. And this year we have 4 initiatives, and Vawnita, you asked, how do people participate? So a number of ways. We want to make this easy, and we're thankful for any gift from $5 to $50,000. I mean, everything helps and helps turn the dial. You can give online. You can call me and discuss other options. You can write a check. We will accept drop-in gifts as well. We respect whether you want to be publicly recognized or remain anonymous to honor your wishes. So we strive to make this a seamless process for the donor, as we're certainly grateful. And a lot of the things that we're able to do at our Critical Access Hospital are only because of donors who believe in supporting local healthcare initiatives. And for many of our Giving Tuesday efforts, quality of life initiatives.
Lynn, can you talk a little bit specifically? So just for those who are unaware, McKenzie Health had their annual meeting today. And so we had a wonderful, very comprehensive report on the healthcare system. And one of the things that you touched on, well, and I think it was a theme in the room from, Chairman Gary Brown, who is the chairman of the healthcare system board, to the CEO and the COO and the CFO. Everybody's common mission or common talking point and theme for the day was how grateful we are for the community, how blessed the community is. And that comes full circle with being able to provide opportunities for people who want to support the mission, give back. Can you talk specifically about the 4 projects you have coming up that you're targeting, but also to know that if that's outside of where you want to be giving, that there are many other opportunities or options as well?
You said all of that perfectly. So when people give, it's a very personal decision, and people give based on what pulls at their heartstrings. Some of it is based on your own personal experiences. Maybe there's a doctor or specialty that you love that provided you great care, or maybe you have a history of cancer in your family, and so that's something you want to offset for others. All of it's a very personal choice. And so if we have, we have 4 options for Giving Tuesday that we're fundraising for. We have a $130,000 goal with these 4 initiatives, but I would like to share, if there's something outside of this that you would like to give to, we're super appreciative. And we do have other things that we are looking for funds for, from an upgraded CT machine to an upgraded mammography machine. Some of those items that are not listed on our Giving Tuesday effort. But these 4 items, so again, the goal is $130,000 that we'd like to raise. And I like to share that as of today, we have $25,000 of that raised. So we have $105,000 to go. And the 4 items that we settled on this year, one is for a transportation vehicle for the Good Shepherd Home and Horizon. And really, this is an important need because there are some things that we are not able to offer in our facility, like a dentist. So sometimes we have residents that may need to go to the dentist for teeth cleaning, or maybe have something repaired, et cetera. So we need to be able to use a vehicle to transport that individual where they need to go. When we are down a vehicle, then, for the Horizon, it means that maybe they aren't able to go grocery shopping that day, or maybe they had a trip, planned over to Powder Keg to eat pizza, or out to Tobacco Gardens to take a drive. If there isn't a vehicle available because somebody has an appointment and maybe there are 2 people at the same time and it's unavoidable, then that group is unable to all, travel for that event. And also, we need a second vehicle so everybody can go who wishes to go from the Horizon, or if a group from the Good Shepherd Home are visiting the zoo, which they like to do occasionally as well. And so the goal there is $50,000. We did receive an $11,000 grant from the McKenzie County Community Foundation, which we're super thankful for. And I also have a couple of other grants out to assist with this. So $50,000 would help bring us across the threshold for what we need for that item. The second item is we're expanding our dining room. So as you can imagine, picture over 400 employees now. And then we also, have our med-surg area where patients who are recovering have family and friends visiting. And we want to create an experience where if you need a break or you want to get a cup of coffee and some lunch, that you can do that. And our space right now is very small. Probably 8 people could sit comfortably. We also know that when people eat together, they have a chance to build relationships. And our goal as an organization is we want to retain our people, but we also want to be able to bring our guests in and our patients, et cetera, for a positive experience in our dining area. So anytime that you're crossing paths with your kitchen, things get a little bit more expensive. So this is an awesome initiative to help us make a dent in our fundraising goals. And again, This is an item where I do have also grant materials out and requested, but it's the type of thing that really helps to bolster and push our initiative across the finish line if individuals believe in and want to help support that as well. And I'll give you an example. If you have a mom who maybe had to bring her high school son into the ER, and maybe he has to stay overnight, after the restaurants close and maybe the gas stations are closed, we have, of course, without the kitchen being open for the evening, some snackable items and some things that you would use, blood sugar control, etc., but not full meals. And this would allow us to vend at a higher degree and really provide for short order foods as well, so we can better accommodate folks when they're in our facility. The next item is oncology patient support items. So that's a rough diagnosis for anyone to come in. It's overwhelming. It's scary. And what we want to be able to do is to say, hey, here's a bag of comfort items for you. You aren't a number here. You're a patient that we care about. And we want you to know that when you're coming to see us for services, we also want you to know that you're cared about as a human being. And so in our patient support bags, and different oncology centers provide these, but, really Dr. Peterson, his team have a vision of, a soft blanket, a coat. It gets pretty chilly here. And people who are experiencing chemotherapy many times will get very cold and have difficulty regulating temperature. So cold to someone experiencing chemotherapy is much colder for them. So a coat, a blanket, a gift card for groceries, a gift card for gas, a journal, and some items in a bag to help this person know, hey, we know you're on a tough journey, and this is to help provide you some care and comfort. And we know any type of diagnosis like that is very, very difficult. And hopefully this will help you know that we are providing something to help lift you up during a tough time. And we want to provide those to all new patients who are coming to see Dr. Peterson. And this fund, we're looking at $25,000 to raise here, would help us purchase those items across the year, so that we can have basically these bags prepared and ready to provide to patient that's coming to us for care. And the last item is a new fund that we've started called the Grace Fund. And this is really a compassionate care fund for our own employees. And we all experience this in some way or another. You're working with a person who's fighting a significant health challenge, or you are maybe dealing with something like a fire at your home or a car accident. And these types of things can really derail families and individuals. And so this will be a kind of a support line, if you will, or a way to lift up type of fund for people that we work with who need a little bit of extra help. And, I leaned on actually a colleague in helping to design this. And I know she's fine with me sharing her name, but Greta Ensrud, who's battling colon cancer right now, we talked about the Grace Fund. She helped name it and reviewed the design. And I think that, in looking at our colleagues and when we need to have grace for others, it's important that we can do these things for our neighbors. And I'd also want to mention that the individuals that donate to Giving Tuesday are also our team members and our staff. The community is super generous, and our team likes to participate and help out with these endeavors as well. So those are 4 initiatives. Again, if anyone that's listening to the program wishes to allocate funds in some other direction, we do have some equipment needs that we're looking at, and I would be glad to have the conversation. And probably, as my dad put it, he said, "Do you drink coffee and eat lunches like for a living?" I said, "Yeah, kind of. I spend a lot of time getting to know people and meet people." And so I just want to put that out there. I'm glad to talk about our foundation and healthcare system with anyone who's interested. And like I said, everything pulls at people's heartstrings differently, and the things that matter to each of us are unique and special. And so we want to make sure that, when you're gifting or providing a legacy gift, even to our hospital, we want to honor that in a way that's special to the donor.
I think the timing is really, really good. And I think people are always looking towards this time of the year. It gives you the opportunity. Thanksgiving's coming up. Christmas is around the corner. It gives you the opportunity to pause on two levels. What do you want to leave for a legacy? Whether it's small bits here and there, or it's a larger legacy, but even in addition to that, people are doing their year-end tax preparation, right? So there's a lot of opportunity to, work with your tax preparer, work with your accountant, identify opportunities to maybe see these gifts stay local, instead of sending them off in your federal quarterly taxes. I think there's a lot of opportunity there. So I want to definitely thank you, Lynn. Like you said, these are quality of life initiatives. And so we rely on a lot of other things to bring in, the hardware, the equipment, the facility, that kind of thing. But these add the extra layer of people taking care of each other, of people knowing that they're seen, they're felt, they're heard, they're cared for. And you weren't in that room, but we had 3 of your providers in last week. And so I feel like they really helped the listening public understand the mission of the organization and how the care is provided just a little differently. And I think these 4 goals through your Giving Tuesday really flush that out even more so. So I want to thank you.
Thank you for having me. I really appreciate the opportunity to talk about it. And as you kind of mentioned, if people see some flexibility in their end of year and they want to give, wonderful. And my own personal philosophy is I've never seen a U-Haul at the cemetery for one single funeral I've been to. And so personally, I love to give, and I like to leave my mark and smile on programs that mean a lot to my heart, one of which is local healthcare. And so if we have something on the list that makes your heart smile or makes you, know or feel like you were able to do something that lifted up another person, we have the opportunities here and available. And I just want to say too, very grateful. We have so many very, very nice and generous donors that help us out to be able to provide these types of things, and really the providers who are providing the care. But this adds the extra layer of special and comfort that we love to give to our patients.
Well, I think the services are such high quality, and I look at just alone, you have your specialties there, but what the Horizon does for the community and for the aging population, and that transitional housing opportunity that it affords people. And also the Good Shepherd Home, listening to that report today, that those both have waiting lists. So the healthcare system takes care of all phases of our community members' lives. It will leave a lasting mark on our community. It's a pillar of our community. And so I want to thank you, Lynn, for the work that you do every day, and that the healthcare team, the services they deliver to our community every day. And so thanks again. Just one last thing I wanted to share out to those listening. When Brock loads all of our information, Lynn's contact information will be in the show notes, and we'll also have some links to the website if you want to find out more detailed information on those Giving Tuesday opportunities. And so people can get a hold of you and have that opportunity to continue to build something great here with McKenzie Health in our community. So
thank you so much for having me today. And if time allows in the future, I'd love to come back and report on all the good things that we tackle after December 2nd.
Well, I think that sounds like a great idea. Thank you, Lynn. Appreciate you.